this is Kavipriya from SNS College of Lateral Science, lecturer. I am going to explain about case study about ventricular septal defect. First of all, we have to know what is ventricular septal defect. That is an abnormal opening between the ventricular septum. Initially it is occurred from the congenitally by birth itself. Okay, after birth, within a month or 3 months or 6 months, the hole get closed. If it is not closed, the defect is called as ventricular septal defect. Initially all the babies having by birth itself having some hole, but later it closed. But if it is not closed, it is called as ventricular septal defect, or atrium site we called as atrial septal defect, abnormal opening. There are types of ventricular septal defects are there: perimembranous VSD, muscular VSD, inlet VSD, and subpulmonary VSD. And if it is perimembranous VSD, it is present below the aortic valve. It is well seen in parasternal long axis window. And again, if it is inlet VSD, there is an posterior to the tricuspid, below the tricuspid valve, and septal leaflet we have seen the 4-chamber window. And subpulmonary VSD, it is an aortic and pulmonary valves. Subpulmonary VSD below the aortic and subpulmonary valve. And muscular VSD means interventricular septum, between the interventricular septum. It is mid-muscular or apical muscular VSD. Okay, there are 4 types of VSD. See, there is a mid-muscular VSD, apical VSD, and pulmonary subpulmonary VSD. Here the clinical features: if there is a large VSD can be present with an heart failure. If it is an VSD is mentioned as large, size is about 3 within 2.5 to 3, which leads to heart failure. Once heart failure can occur, we need to change a heart transplant, change the heart. So heart transplant is an best treatment. So if it is a large VSD can be present with a heart failure in an infancy, while a small one, it is usually in asymptomatic. So they can cause only pansystolic murmur. Okay, lower left sternal end we can observe pansystolic murmur, and presence of left to right shunt also. Once a left to right shunt present means there is a pulmonary artery hypertension will also be there. Initially it is a right to left shunt, but later it turns to, initially it is a left to right shunt, but later it turns to right to left shunt. Right to left shunt means a normal, a deoxygenated blood get mixed with the oxygenated blood. The time the patient may feel cyanotic, breathlessness, lower limbs or weakness, and blurred eyes, breathing difficulties, constipation, indigestion, sleeplessness, fatigue, muscle weakness, and all. So this is called as Eisenmenger syndrome. Initially it is a left to right shunt, and later it turns to right to left shunt with dilated chambers. And see, there is an Eisenmenger syndrome is well explained. See, RV to LV, right to left shunt. It is called as Eisenmenger syndrome. And see, Eisenmenger syndrome is most often complication of having hole between the chambers, either right, mostly in a ventricular septal defect, and either also be an right atrium site also. Okay, it can cause blood flow to the lung and arteries. So eventually the extra blood flow cause and blood vessel to get stiffened, more stiffened and narrow. So which can cause increase in blood pressure in the lung and arteries. Okay, increase in blood pressure in lung and arteries. The high pressure cause walls of right lower heart chamber, which is get thickened. Okay, very thickened. See, the right ventricle get thickened comparatively left ventricle, and the cavity size also diminished. Okay, what is Eisenmenger syndrome? Here the hole between the ventricular septal defect, it can cause more blood flow to the lungs and arteries, and eventually extra blood flow to the heart, which cause blood vessels very stiffened and narrow, which means resistant, causing resistant. So increase in pressure in the lungs, arteries, and high pressure can cause a walls of right lower heart chamber become thickened, and right ventricle hypertrophy will occur. Okay, this is called as Eisenmenger syndrome. Thank you all.